Hello and welcome to Focus on Health. I'm Dean Leisgang. Today we're at the Aurora Medical Center in Oshkosh where we were talking about dorsal root ganglion spine stimulation. Dr. Mansoor Aman, a pain management specialist, joins us to provide some insight. Dr. Aman, thank you so much for making time to provide some insight on this important topic.
Most definitely. Thank you for having me.
Absolutely. So let's just start kind of in broad strokes. Can you describe how pain is processed in the body?
Absolutely. I mean, that's definitely a complex process, but if I had to break it down, I'd break it down in 4 steps. And the way that I conceptualize how pain's processed is first we think about where the injury is. And at that level of injury, so for example, if it's in the foot and ankle, there may be some chemicals that are being released from the foot and ankle, and that's called transduction. After that happens, those chemicals have to travel, and they travel to kind of what we call the command center of pain that lives in the spinal cord. So that's step 2 of traveling is called transmission. Third, and probably most importantly, is in our body we have mechanisms that play at the level of the spinal cord that help reduce pain signaling when we're really hurting, and that's called modulation. And the 4th step in the pain processing pathway is perception, where we feel the misery of pain. We can't enjoy things that we were able to do prior to the onset of pain. So that's kind of how I would define pain processing in that 4-step pathway.
So you mentioned modulation in there. What is neuromodulation in relation to this?
Great question. So neuromodulation is using essentially electrical currents to reduce the nerve firing and help better manage pain. At that 3rd level that I described, as you picked up on, that modulation. So we're essentially using assistance of electricity to help reduce our pain signaling at that spinal level.
And then one of the things we wanted to hit on was DRG stimulation therapy. What exactly is that?
Yeah, so DRG is actually a bundle of nerves that lives very close proximity to the spinal cord. And that's where the soma, or the cell body, or command center of pain lives. As those signals come from our foot and ankle and leg, they have to traverse the DRG to enter our spinal column. So it's actually a bundle and a structure. Now, DRG stimulation is actually using the same electrical currents to block pain level at the level of the DRG as it's entering the spinal cord.
What patients would benefit from the DRG stimulation therapy?
Absolutely, great question. So DRG is really meant to be a focal, pinpointed, targeted pain relief. So if someone has specific pain along their foot and ankle, whether it's chronic pain after multiple joint operations, or if someone has specific pain at the knee joint after multiple knee revision surgeries, or even groin pain after an inguinal hernia repair, these are specific focal joints. So with this technology, we're able to target specific locations without applying energy and electrical stimulation to areas where we don't really need the pain relief.
And I know you brought some props with you. How is the procedure performed?
Absolutely. So what I like about the procedure is that it's a 2-step procedure. So we break it down into what's called the trial phase. Now, during the trial phase, a patient really gets an opportunity to see firsthand if this therapy is going to help better manage their chronic pain. During the trial procedure, a patient is typically laying on their belly, and there are some anesthetics involved to make sure the patient's comfortable for the procedure. And under live X-ray guidance to optimize safety, we typically place a number of leads along these dorsal root ganglion. And the lead is a very fine lead, typically with 4 contacts, and it looks something similar to this. Once the leads are positioned in a perfect spot, it's connected to what's called an external pulse generator, a battery pack. And the patient goes home and tries this actual stimulation for their pain for anywhere between 3 and 7 days on average. And if you come back to the office with a big smile on your face and you're sleeping better and you're walking better and your pain's less, we know that this therapy is going to be something that's helpful for you. Now that you've tried it, the trial wires come out and we schedule a permanent implant at a later date.
Risk and benefits with any procedure. What are the risk and benefits for this therapy?
Absolutely. So, I always tell my patients, whenever there's any needle going into your body or any incision being made into your body, the risks are relatively similar in that there's a possibility of infection, there's a possibility of bleeding or damage to any surrounding structures. With this specific therapy, since there are wires and electrodes involved, there's a couple of additional risks that we have to consider. Things like what's called lead migration, where one of these wires might move, or lead fracture, where if someone has a fall or injury, one of the wires might fracture and we might lose the pain relief. Another thing to consider is that if the patient has a permanent implant, there is a little battery pack that's implanted into the body. Now, as I mentioned during the trial procedure, there is that external battery pack. If the device works for you, then we go ahead and we implant this battery pack, and it usually sits somewhere in the lower part of the back buttock area. It's quite rare that we see infections of things like this, but it can happen.
So for the viewers watching at home, would it be fair to say that the device is similar to a pacemaker in concept?
Absolutely. I mean, the IPG, the internal pulse generator, the battery pack, is very similar to what people have in their chest wall for a pacemaker. The difference is a pacemaker, the wires and electricity is targeted toward the heart, whereas with this wire and device, we target towards the spine.
Wow, technology at its finest right there.
Absolutely, absolutely. And the other thing I'll say is all of this is FDA approved, proven by level 1 scientific evidence, meaning there's randomized controlled trials that showed benefit and superiority of these types of devices in managing chronic pain.
Dr. Aman, we sure do appreciate your time and your guidance on this topic.
Absolutely. Thank you so much.
Appreciate it. If you still have questions about DRG or would just like some more information on the topic, feel free to reach out to Dr. Aman or your primary care provider at 920-303-8700. Thank you so much for joining us today. I'm Dean Leisgang, and we'll see you next time on Focus on Health.